Good morning. My name is Virginia Cuevas, and I'm here to report on plantar fasciitis. Plantar fasciitis is one of the most common cause of heel pain, and it involves inflammation of a thick band of tissue that runs across the bottom of your foot. And this tissue connects your heel bone to your toes, and this is called plantar fascia. The risk factors that are involved in this inflammation is number one, age, whereas it is most common between the ages of 40 and 60. Certain types of exercises, those that place significant stress on your heel and attached tissue, such as long distance running, jumping activities, ballet dancing, and so forth. These all can contribute to an earlier onset of plantar fasciitis. Anatomy or foot mechanics can also be a risk, where being flat footed, having a high arch, or even having an abnormal pattern of walking can affect the way weight is distributed when you're standing and put added stress on your plantar fascia. When you're obese, of course, the excess pounds put extra stress on your plantar fascia as well. And of course, occupations that keep you on your feet, like factory workers, teachers, and needless to say, nurses who spend most of their work hours walking or standing on hard surfaces can damage their plantar fascia. The causes for plantar fascia would be the following, and under normal circumstances, your plantar fascia acts like a shock absorbing bowstring supporting the arch in your foot. If tension and stress on that bowstring become too great, then small tears can arise in the fascia. Repetitive stretching and tearing can cause the fascia to become irritated or inflamed, and though in many cases of plantar fasciitis, the cause really isn't clear. However, um, overuse, not anatomy, is the most common cause of plantar fasciitis in athletes. Dorsiflexion of the toes applies traction stress at the origin of the plantar fascia, and this starts the pathophysiology of plantar fasciitis. It results to repetitive microtrauma to the plantar fascia, causing collagen degeneration and tearing, and eventually inflammation. And so the most common symptom for plantar fasciitis would be pain. Plantar fasciitis typically causes a stabbing pain in the bottom of your foot near the heel, and the pain is usually the worst with the first few steps after awakening, although it can also be triggered by long periods of standing or rising from sitting. And the pain is usually worse after exercise, not during it. Of course, some of the other symptoms would include inflammatory symptoms like redness on the bottom of your foot, swelling, and tenderness to that area. The diagnosis is made based on the medical history and physical examination. During the exam, your doctor will check for the areas of tenderness in your foot. Where your pain is situated can help determine its cause. And usually there are no tests that are necessary, but your doctor might suggest an x-ray or magnetic resonance imaging just to make sure your pain isn't being caused by another problem, such as stress fracture or a pinched nerve. Sometimes an x-ray shows a spur of bone projecting forward from the heel bone, and in the past, these bone spurs were often blamed for heel pain and are removed surgically. But most of the time, many people who have bone spurs on their heels have really no heel pain. Most people who have plantar fasciitis recover with conservative treatments, including resting, icing the painful area, and stretching for several months. Pain is relieved by ibuprofen and naproxen sodium, which can also ease the inflammation that's associated with plantar fasciitis. Stretching and strengthening exercises like previously mentioned, or use of specialized device may provide symptom relief, and these include physical therapy, where a physical therapist can instruct you in a series of exercises to stretch the plantar fascia and the Achilles tendon and to strengthen lower leg muscles, which stabilize your ankle and heel. A therapist might also teach you to apply athletic taping to support the bottom of your foot. Night splints. Um, your physical therapist or doctor might also recommend that you wear a splint that stretches your calf and the arch of your foot while you sleep. These holds the plantar fascia and Achilles tendon in a lengthened position overnight and facilitates stretching. And your doctor also might prescribe off the shelf or custom fitted arch supports, which are called orthotics, to help distribute pressure to your feet more evenly. And when more conservative measures are not working after several months, your doctor might recommend injections, where they inject a type of steroid medication into the tender area that can provide temporary pain relief. Of course, multiple injections are not recommended because they can weaken your plantar fascia and possibly cause it to rupture. Extracorporeal shock wave therapy is also used, and in this procedure, sound waves are directed at the area of heel pain to stimulate healing. It's usually used for chronic plantar fasciitis that has not responded to more conservative treatments, and this procedure might cause bruising, swelling, pain, numbness, or tingling. And some studies show promising results, but it hasn't been shown to be consistently effective. Tanix procedure is an invasive or a minimally invasive procedure that removes the scar tissue of plantar fasciitis without surgery. And as a last resort, surgery can also be used to detach the plantar fascia from the heel bone. And it's generally an option only when the pain is so severe and everything else fails. And side effects, of course, include weakening of the arch in your foot. So, patient education. It's important that we maintain a healthy weight. If we are overweight um, or obese, we have to lose that weight to minimize stress on your plantar fascia. Choose supportive shoes, avoid high heels, and get those that have low to moderate heel, good arch support, and shock absorbency. Do not go barefoot, especially on hard surfaces. Do not wear worn out athletic shoes after about um, 400 to 500 miles of use. Athletes should really be replacing their old athletic shoes as they do stop supporting and cushioning your feet. Um, Change your sport is another one. If you could try a low impact sport such as swimming or bicycling instead of walking or jogging, that would probably reduce stress and pain on your foot. And then you could also apply ice. You can hold a cloth covered ice pack over the area of pain for 15 to 20 minutes, 3 to 4 times a day or after activity. Try ice massage, as regular ice massage can also help reduce pain and inflammation. And lastly, we can stretch our arches. Simple home exercises can stretch your plantar fascia, Achilles tendon, and calf muscles. That ends my presentation for plantar fasciitis. If you wanted to have more information on that report, you can look up these references by Muth, Landorf, and Cole. Thank you and have a good day.